Hi, this is Dr. Dan Beelan, and this is locating the skin points on regulation thermography. One of the most important things when conducting a thorough regulation thermometry screening is accurately locating the skin points, as well as ensuring that we measure each point in the fairly same location before and after the thermal stress. In this section, I'll take you through all the skin points, defining their anatomical locations and geographical references to help you best identify each point, as well as the correct positioning and approach angle of the AlphaSight probe. So let's go. We get the most accurate measurements when the probe approaches the window perpendicularly to each point. So we want the probe to measure the skin, and you just briefly touch the skin, wait for the second beep, and then remove the probe at least 6 inches away from the body. The first point on the head region is the glabella. That helps us determine the baseline of the whole thermogram, and it's the most regulated point on the body. This is the only time that we do any point 3 times. So we're going to test this first glabella point 3 times. If the temperatures are inconsistent with each other, it'll ask you for a 4th or a 5th time. It's in the center. The next point is the radix nasi. It's in the lowest part of the bridge of the nose. If you look at the 3 pins on the electrode, then you'll be able to see that it fits kind of snug onto the bottom 2 in the lower part of the radix nasi. The next one, which was done earlier on, I see the order of these things is a little bit off. This is the cubital fossa. The cubital fossa is done making sure you do not test the vein. So many people, you can see superficially where a vein is, and you want to go lateral or medial to that vein. Just don't go on the vein. And remember where you've gone. So you may want to make a mark as you touch the probe to the body. You can have a marking pen and mark where you've been, so you can return to the same point when you come back and do it 4 times. The next is the dental region, which you in the programming, it comes earlier than the body. The dental region is perhaps the most difficult area to discern. It's done by drawing a straight line back from the frenulum, that crease above the lip, upper lip, to the front of the mastoid muscle. So you can kind of grit your teeth and feel the front of that muscle, and that will be the 8th point that you measure. You can mark it with a pen, the front of that muscle, and you can actually position your 4 fingers close to each other to define the first 4 and then the second 4 points in each quadrant. Remember that the probe is bigger in diameter than the points you want to measure, so when you come back to measure the 2nd, 3rd, 4th, 5th, 6th, 7th, and 8th points, they're not very far away, so there is a tendency to go too far too fast, and it's important that you don't do that. The measurement is done to try to measure the area that's between the end of the gum and the tooth. So we're really measuring the junction of the gum, but through the face, as you can see here. and then measuring tooth by tooth. I think it's fairly clear the placement. Whenever you make a mistake or if you think something is wrong, you can always press the button on the upper left of the screen that says point backwards, or you can touch the screen on the point and it'll start from where you need to correct. And the same with the lower quadrant. Make sure that you don't bump them into each other, overlap, and you don't go too much onto the jaw, and you stay within that line that you can kind of roughly perceive through the face. These numbering systems are the head region. The next is the frontal sinus point, which is just above the medial edge of the eyebrow. This is a bladder point in acupuncture, but a reminder, these are not acupuncture points. These are neurological points. This is a bilateral point, not like the glabella or radix nasi, and it's important to know that some points are down the midline and others, most of the points, are on two sides of the body. This is done very easily. This represents just the frontal sinus. It has no other meaning. The next point is the temple points. These are drawn correctly in this diagram. They're a little bit higher in the Alpha Sight software, which is soon to be corrected, and probably by the time you get this within the month it will be corrected. However, just remember it's on the end of the lateral portion of the eyebrow in a depression in the temple, in the front third of the temple. The next is called the commissura palpebrum. These are very important indicators for the internal carotid circulation to the brain. This is done by placing the probe in an upward position, so you can change your the way that you are holding the probe so that the probe is really under your hand. Here is one way to hold it. However, I advocate holding it with your hand above the whole probe and coming from underneath. You notice how it's pointed towards the opposite parietal aspects of the cranium. This is an important point to measure internal carotid circulation. The next point is the ethmoid sinus. This is just below the inner canthus, but in perpendicularity according to the nasal bone. This is a very important point for the identification of virus. If the two sides are very asymmetrical, I think there's a small error on the human diagram, but look at the Alpha Sight thermogram. If these are asymmetrical, it's a viral sign. So this is very key in sinus and viral. The probe is placed perpendicular to the surface of the nasal bone. The next point is the maxillary sinus. These are directly down below the pupil. So if you follow the pupil line below the mastoid process, you'll have the indicators for the maxillary sinus. Below the maxillary process, that's the cheekbone, but in line with the pupil. That's the maxillary sinus, which represents itself. The probe is placed absolutely from a forward approach directly to the patient. The next point in the neck region is the mastoid process. This is more accurately shown on the human diagram. It's behind the ear, right under the apex of the mastoid bone. So it's almost like you're taking the temperature of the bone, and that is a representative of middle ear, internal ear, jaw, and neck. This is a chiropractic point and a vestibular point. The next point in the neck region. The next is the tonsil point. The tonsil is the first lymphatic point. This is it's under the angle of the jaw and the soft tube. The probe is placed there. Make sure you're not measuring on the bone, but in the soft tissue underneath the bone. The next point is tonsil 1 is the lymph 1 point, L1 and L2, exactly halfway between the tonsil point and in the soft tissue. This is a lymphatic point. The next point is the sternocleidomastoid, which is done directly and with a frontal approach. This point is midway between the connection of the sternocleidomastoid to the cranium and skull and to the clavicular region. So with that long stretch of the sternocleidomastoid, it's midway, and you use a frontal approach. This is a lymphatic, which was not done apparently in this diagram, was missed. The next point, we have it a little bit out of order then, the infraclavicular fossa, just lateral to the supraclavicular fossa, but below the clavicle in the depression. The next is the thyroid, which is the only point that should actually warm beneath the head. All points should cool normally, except for the thyroid if it was in perfect condition. In our society today, the thyroid is often not in a perfect condition, and is a very complex organ. So on both sides of the thyroid is the thyroid point. This is not done very laterally, but very close to the chest. But that's a little bit lateral, which is L7 and L8. A little bit lateral and below the clavicle. Then this is the thymus point, the leading indicator of the whole immune system. This point, when blocked or paradox, is an indicator of a weakness of the immune system as a whole. The next is the chest region. The first point on the chest is the sternum. This is 1/3 the way down from the thymus or suprasternal notch to the solar plexus, which is right over the xiphoid process. So 1/3 the way down, not halfway down, but 1/3 the way down is the sternum point. The next point is the pectoralis muscle. This is at the edge of the axillary fold, just above the end of the axillary fold. This is a very important lymphatic point going into the breast, as well as a pericardium point. The next point are the heart points, IC1, 2, 3, and 4. The IC1 and 2 are between the third and fourth ribs, just below the sternum point, about 1.5 centimeters to 2 centimeters lateral of the midline. The next is IC3 and 4 between the 5th and 6th ribs, approximately at the same level as the nipple if there were male breasts. So you skip a rib between the IC1 and IC3. There are 4 electrocardiology points, and they help us to discern heart versus pulmonary versus epigastric. The next is the upper abdominal region. The solar plexus is the xiphoid process. Now you don't want to touch these points, but you could when you first see the patient to know where they are. But the more you touch the body, the more affected the readings will be, so you should not touch the points. Solar plexus at the end of the xiphoid process overlooks the upper abdomen, which includes the liver, pancreas, gallbladder, and stomach. The next is the stomach point, which is itself, it's a big indicator that goes cold during breast problems and disease. It can also indicate infections in the stomach, such as H. pylori or hiatal hernia. The next is the liver points. There are 2 liver points on the right side, so they're labeled with odd numbers 1 and 3. Then notice how the nipple point is almost directly above liver 3. So you make an equilateral triangle from liver 1, liver 3, and gallbladder, approximately 2 centimeters from each other. And you'll do that equilateral triangle below the rib. Make sure that it's below the ribs. So you can have them pull in their stomachs if you need to discern the rib line. The gallbladder is the gallbladder, very important point. But you have to group these in terms of hepatobiliary because they're very closely connected. The next are the pancreas points. Pancreas 1 on the right side is more exocrine in function. Pancreas 2 is more endocrine in function. The next point is the small intestine point, which is a very big indicator for food intolerance when it's colder than the rest of the points in the lower abdominal region. This is about 1.5 centimeters below the navel. The next points are the ascending and descending colon. They can either be at a slight angle forward as you go down, or they can be 3 points totally vertical. The good way to position them is you take your middle finger and you put that on the same level as the navel and you draw it out approximately 3 centimeters from the navel. So that's at the same level horizontally to the navel, and then colon 1 above it by about 2 centimeters and colon 5 below it by about 2 centimeters. The same thing with the left side, which is the descending colon. The next is the appendix point, which is about 3 centimeters lateral and inferior or lower to the belly button, to the navel. It's at the McBurney's point where surgeries are usually done for appendicitis. That's a very big indicator, along with the small intestine, for food intolerance. The next is the uterus or prostate point, which is done just above the start of the pubic hair on the midline. Whether it's a man or a woman, it's at the same point. However, the next point, the ovary point or inguinal lymph on men, is on women about 1 to 1.5 centimeters medial to the inguinal groove. That's the groove that defines your leg, that groove that's there. And in men, it's in the groove. So men is more lateral by 1 or 1.5 centimeters than the ovary point, which is more medial. And it should be at the same level. This shows it a little above. It should be at the same level as the uterus or prostate point, wherever that is for men or women. The inguinal lymph is shown here, so you can see the difference, but it all should be in one line. The back region is for kidneys and another chiropractic point. The ribs are defined, and then you can find the kidney point. Just below the ribs, about 1.5 centimeters to 2 centimeters lateral to the spine. Remember that the right side that you start on is now on what is obviously the right side. So it's different when the patient is facing you. Kidney 1, all the odd numbers are on the right side, as you remember. And then sacroiliac is for the lower back, sacroiliac. It can also reflect the uterus and pelvis. The American numbering systems, which does not correlate to the international system, so if you're in any other country, there's a different number to the teeth, which we have in our reports, so all the reports show the correct number no matter what country you're in. The breast region is fairly clear. This is the body of the breast. The pattern is always start from above, from outside or lateral and above, and go downward. So upper, outer, and downwards in that circle. There's points that are on this plus and points that are on the A, on the X. So the big letters that don't have a number, A, B, C, and D, are on the X, and A1, B1, C1, D1 are on the plus, and then little A, B, C, D are just outside of the areola, and point E is on the nipple. So you have to kind of make this chart according to the breast of that individual. And here you can see the positioning. Actually, the little A, B, C, D on the right, the two C and D points should be a little bit closer to being on the areola. This is point A, point B, A1, point B, point B1. Now this point, if there are very large breasts, you must use only the point that's touching the air. Do not lift the breast or touch the breast or change the position that they're naturally lying in, but just touch the point closest to the one that's touching the air. That will still give you an accurate reading. This is B, B1, you see that's on the plus, C, I'm sorry, yes, sorry, that's A, B, C, D, and D1. And then little a, little b, little c, and little d. And then the nipple. If you don't get any point on the nipple, or it keeps telling you that it's not a good test because maybe the nipple is too cold, because that'll be the coldest point on the breast, then you can do somewhere in the areola as your nipple point. And that